No more pertussis whooping cough. Whooping cough pertussis is a highly contagious bacterial infection. The initial symptoms are usually similar to a common cold, with symptoms such as runny nose, fever and mild cough. The next few weeks will be accompanied by a severe cough, and even a high-pitched whooped sound will be made when breathing. This phenomenon may last for more than 100 days or 10 weeks. Infected people may feel vomiting and tired due to severe coughing, or even cough to the point of breaking their ribs. Coughing may not be obvious in children under 10 years old, but they may temporarily stop breathing several times. Generally speaking, the incubation period from infection to onset of whooping cough is 7 to 10 days, and whooping cough can cause milder symptoms in those who have been vaccinated. Man-made B. pertussis is the only host, and its main targets are children. Half of the cases are infants under 1 year old, and the disease is more common in girls. The infection route is mainly through airborne infection, indirect, or droplet infection, direct. After the germs are spread through the droplets in the patient's respiratory tract, they enter the respiratory tract of the susceptible host and are infected. It does not need to be transmitted through a vector. Infectious germs are often brought home by siblings or parents. The disease is highly contagious before paroxysmal coughing occurs in the early stages, and then the contagiousness gradually decreases. After about 3 weeks, even if the patient still has a persistent spasmodic cough or asthma, he is not contagious. Typical symptoms of whooping cough are paroxysmal coughing, inspiratory wheezing, paleness, and possibly vomiting after a severe cough. Pertussis cough has been found to cause subconjunctival hemorrhage, rib fractures, urinary retention, hernia, post-cough syncope, and vertebral artery dissection. Severe coughing can cause pleural rupture, leading to pneumothorax. If vomiting occurs after a cough or a high-pitched roar while coughing, the likelihood of a diagnosis of whooping cough is doubled. On the other hand, patients who do not have paroxysmal coughing or vomiting after coughing are unlikely to have pertussis. Whooping cough is a disease caused by the bacterium Bordetella pertussis and can be spread to others through the cough or sneezing of an infected person. It is an airborne disease. The patient is contagious to others from the onset of illness until a severe cough begins about 3 weeks later, but is no longer contagious after 5 days of antibiotic treatment. Testing for this disease is mainly carried out using nasopharyngeal cotton swabs, and the specimen can be tested and confirmed through bacterial culture or polymerase chain reaction. Whooping cough prevention is mainly carried out through vaccination. The first dose is recommended at 6 to 8 weeks of age, followed by 4 doses by age 2. The effectiveness of the vaccine deteriorates over time, so additional vaccinations are recommended for older children and adults. Antibiotics may be used to prevent the disease in people who have been exposed and are at risk of severe disease. For people with the disease, antibiotics are effective within 3 weeks of the first symptoms, but beyond that, they have little effect on most people. It is recommended for children under 1 year old and pregnant women to take it within 6 weeks of the onset of symptoms. Antibiotics used for treatment include erythromycin, azithromycin, and cotrimoxazole. There is still insufficient evidence for the efficacy of these drugs in treating cough. Many children under 1 year old require hospitalization. It is estimated that whooping cough infects approximately 16 million people worldwide each year. Most cases occur in developing countries, and people of all ages are at risk. In 2013, the number of deaths from whooping cough dropped from 138,000 in 1990 to 61,000. Nearly 2% of children infected with whooping cough die before reaching the age of 10. The first record of a large-scale outbreak of whooping cough was in the 16th century. The pathogen causing whooping cough was finally discovered in 1906. It was not until the 1940s that a whooping cough vaccine became available.